Okay, hi ladies, Dr. Buford. We're just getting started on your left shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen, and you're laying on your side. So this is the long head of the biceps tendon here. This is the biceps anchor. You can see the fraying in the anchor and some of the changes in the cartilage there. And then as we look behind the biceps, we'll see the rotator cuff tear, which is this large hole in the tendon right here. So we're going to have our work cut out for us there. We're going to look around towards the back of the shoulder. This posterior capsule looks pretty good. Posterior aspect of the humeral head has some thinning of the cartilage, but otherwise not too bad. We got our shaver. You can see a little bit of a ding on the glenoid here, but again, that whole area is maybe 1 millimeter, maybe 2. So things are magnified quite a bit. As we look down the front of the shoulder, a little bit of fraying of the labrum, nothing that needs to be repaired. Okay, rotate your back around. And so what we're going to do next is take care of the biceps so it doesn't cause any more problems in the joint, and then we're going to work on the rotator cuff. Pause. Okay, here we are passing our needle right through the biceps tendon. We're going to pass a wire through. We call this wire a super shuttle or a shuttle relay. It allows us to move suture back and forth through the soft tissues. And there you can see how we do that the first time, and now the next little trick is to do it one more time. I like that spot. We'll go ahead and feed the wire in once again. Now the trick here is we're going to let go, we're going to reach around behind the biceps. And retrieve the wire here. And now that gives us this real strong kind of purse string stitch around the biceps, as you see there. The next step is to take a pair of scissors and cut the biceps at its base. Okay, and so now that biceps will no longer be able to cause pain inside the joint because we've just removed it from inside the joint. The labrum here that's remaining looks stable. I don't think we have to do anything else to it, especially now that we've removed that distracting force from the biceps tendon. We're going to look up at the rotator cuff here. And we can see that this is a very big tear. Okay, we're going to go ahead and switch positions with your shoulder here in just a minute. Pause. Okay, so here's the tear in the rotator cuff. Anterior is over here. You can just see the edge of the biceps tendon there. Posterior is back here. You can see this is the posterior edge of the tear. This is some synovial or bursal tissue that we're going to debride so we can see a little bit better. Now we've got the margins of the tear pretty well delineated. Now the joint is down through that hole. You can see how that's down into the joint there. So the next step for us is going to be to find a good angle to place our first posterior suture anchor. We typically work from posterior to anterior because it allows us to repair these tears with minimal tension and to lay them down anatomically whenever possible. So what that means for us is we're going to take a spinal needle, and we'd like to have about a 45-degree angle. You can see how this tear goes back up under like that. I think our first anchor is going to go down right about here, and then we'll probably get a second anchor up here. Each anchor has 3 sutures. So, hold on. I'm going to do something here. I'm going to need that nylon stick. Okay, I just wanted to show you something about the tear. You can see how it's what we call delaminated. See, it's split into a couple layers back here. See that? And so it's real important in the repair to make sure that we address that with our suturing technique. We've got our guide in position, and now we're going to use a mallet just to tap the anchor down into the bone. And now that the anchor's down, we'll pull back on it to seat it. Feels very, you can see I'm pulling the whole ball there, so that's very solid. Now we're going to reach in from the left side of the screen to take out one of the sutures. We're going to start with this black and white stripe suture, and then from the right side of the screen, we're going to bring in our suture hook. So here's the suture hook coming in right there. And with the grasper, we're going to reach underneath here. Just want to make sure we get that deep layer. See that deep layer there? That's real important to include in the repair. So we're going to place our stitch like that. And there you can see we're coming underneath. See that all the way underneath. So that's perfect. We're going to go ahead and feed the relay, retrieve it, and then we're going to load that relay outside your shoulder.
Okay.
And now we're going to go ahead and reach in and get the partner black and white suture, which is right here. And then one of the things we'll do in these types of tears where there's going to be a lot of sutures is we'll tie this first one just to give us a good anchoring spot posteriorly. So what we'll show you now is our first knot coming down on that black and white suture. Pause, please. Okay, just want to show you, we've tied the first knot. It's right here. Show me over here. Okay, there's the suture, and you can see how that's nicely brought down the cuff. Now we've got a slightly different curve. So this is a 45-degree turn to the left, we call it, because we're going to be turning it this way. And just like before, we'd like to get underneath, make sure we get this deep layer. And the way that we ensure that our stitch is right is we start here, we rotate back, and this is about where we want to go in. And there we are underneath right there. So, okay, pause please. Okay, so we've tied 2 of the 3 sutures from the first anchor. I'm not sure if I mentioned it, but each anchor gives us 3 stitches to work with. So let me just show you the 2. There's the black and white one, and then there's the blue and white one, which, hold the camera still, you see it right there. There's the knot. And you can see, if you look at the tear, you can see how this is starting to look better. We've still got all this area here that needs to be repaired. We're going to reach underneath here, try and get this deep layer once again, like that, just to hold it stable. And then we're going to reach in here, go down and all the way underneath. There we go. You can see how we're all the way underneath. I like that shot. We'll go ahead and feed the relay. Pause. Okay, we're just tying the next suture in line, so I wanted to come back up on the video and show you our progress. It looks good. You can see how we tighten down that locking knot. down flat. Okay, so we'll go ahead and clip that suture. And by now you've kind of got the picture. We're just marching across from right to left, which is from posterior to anterior. So there we've tied those sutures. We've got these to tie here from a second anchor that we placed. You can see there's 3 more sutures. We still have that hole there that we need to cover up. We've got the back of it pretty well secured. Now we're going to take the black and white stripe suture from the second anchor. Right there, right there. We're going to bring that inside the cannula back here. And then we're going to tie another knot. Pause, please. Okay, I just want to show you how we're going to secure the biceps. We've placed a 3rd suture anchor right at the tip of the needle. This is the long head of the biceps. You can see our retraction stitch is still in it. And there we are, passing right through it. We'll go ahead and feed that wire. Pause, please. Okay, so we're finished here. Here's the biceps secured. You can just see it right there. Here's the rotator cuff repair going all the way back. And so I'm really happy with the way that looks. We're going to go ahead and finish up here shortly and get you back to the recovery room. Pull that. You can see as we rotate the shoulder, everything moves together as a unit, including the biceps, and that looks very solid. So I'm very happy with the way that looks, okay? Good luck to you now. Bye-bye.